I am so excited to speak to our guest today. She is an aesthetic nurse practitioner all the way out of Doral, Florida. Please help me to introduce aesthetic injector Samantha.
Hi, I'm so excited to be here.
Hi, my name is Jonathan McLean, and I'm the founder and CEO of McLean Aesthetics.
Welcome to the dark side.
Let's go!
Hey Samantha, how are you today?
I'm doing good. How are you?
Doing good, doing good. We're in the South Florida area right now. It is blazing outside in the winter. I love it here.
Always hot. You gotta love it.
Now you're from South Florida actually, right?
Yes, I was born and raised in Miami.
What made you want to, I guess, open your clinic in the Doral area?
I think I was in between a few areas, both in Broward and Miami. This opportunity kind of came up where I got the chance to partner with someone who had this facility already in place. It just was a medical clinic looking to turn to aesthetics. And, you know, at least Doral's notorious for being kind of like a younger generation, you know, women who are very open to anti-aging treatments. And it just seems to be like one of the places I would say in Miami that is a good location to start a clinic like this.
Nice, nice. And I look around the clinic and it looks amazing.
Thank you.
I can't wait for you guys to see it.
Thank you.
But you obviously didn't start here. So let's go back to the beginning.
Yes.
How did you get inside of this industry?
So to start, at least straight out of high school, I went into nursing and I did bedside nursing. I was in like a critical cardiac surgical care unit for like 5.5 years, looking for what the next step was going to be. So I was in between kind of the two routes nurses go, or either anesthesia, nurse practitioner, kind of in those realms. Did a few shadowing opportunities with anesthesia, didn't really seem to fit, you know, what I wanted long-term wise, and then went the nurse practitioner route. I was in the route of kind of going pediatrics until my mom was actually the one who introduced me to a doctor in London. His name is Dr. Taktok. She followed him for a long time, and he's an aesthetic injector there. He's a doctor who then became an aesthetic injector. So similar route, he was in medicine and then kind of drifted that way. And he dives very deep into anatomy. His trainings are very based on that. So that's kind of what drew me into it, that yes, it's about making people beautiful, which is nice and refreshing compared to what I come from. But there's also a lot of anatomy and science behind the products we use, the technology we use, and the aging face. Hence this big art right here. So yeah, that's what ended me this way. Trained with him, and kind of the rest is history from here.
Okay, nice, nice. Now, being in the industry, tell us, how has it been opening your own spa? What struggles have you seen doing it?
I think opening, one of the challenges or the questions that I always had was, is there room for me?
Yeah.
You know, some would say we're oversaturated in Miami, but I think once I opened and once you start seeing there's enough room for all of us. You know, the aesthetics field is only growing. Miami is, you know, has a high population, lots of people, like I said, open to anti-aging treatments. And I think that every provider kind of has their own niche, and, you know, patients have different connections with different providers. So I think there's room for everyone, as long as you kind of find your thing and you stay up to date with things. I think there's room.
Yeah, no, I agree with that 100% because you are a brand of your own. People want to come see you because they like you and what you bring to the table. Yeah. So everybody brings something different to the table that attracts that patient.
Agreed.
Now, you have a lot of different lasers or machines in here right now.
Yeah.
How did you know which ones to pick and which ones you wanted?
I didn't. A lot of research, a lot of trial and error. I went to a lot of trade shows. You know, you meet with a lot of reps when you start this industry. They seem to find you somehow. But kind of knowing the science behind and getting those clinical based studies and really truly knowing why they work and how they work helps you to narrow it down. Yeah. And they each do something different. You know, you never want two machines that compete with each other.
Gotcha. How has clients been about the machines? Have a lot of them been hesitant, or has everybody been kind of like?
I think at first they're hesitant. What I tend to do to make them less hesitant is offer their first one discounted, for example. I truly believe in the machines that I have. If not, I wouldn't have bought them. Yeah. So I try to explain to them the best. If they're good candidates for them, let them try one at a discounted price. Let them fall in love with it, and then it's easier to sell. But smart. It is hard, yeah.
Yeah, I like that because you're giving them a sample to see.
It's almost like they get to test drive it at a discounted price, but, you know, little by little, they gain your trust, and then they start, fishing into more things.
Nice. Now, I wanted to go back to a comment you made a little while ago about branding, right? Everybody separate from each other.
Yeah.
How do you separate yourself from other people?
I think off the bat, when I started, I knew I wanted to make like the anatomy of the aging face, like the base of my practice and my brand. It's part of what I learned when I was in London and what they kind of engraved in me and what attracted me to the field. So anytime a client walks in here, they can vouch for the fact that I'm up here with a white dry erase marker explaining why they're unhappy with X part of their face, like what is going on underneath, so that they feel comfortable in knowing that this is why we're doing this treatment, this is why it's unsafe, this is why it's safe, and this is how we avoid issues, etc. It's not just, I think aesthetics is moving away from let's just treat the line, and it's more like holistic, what's going on at the bone, the muscle, the fat pads, etc., and treating it more, like I said, holistically. So I think I would say that. And my slogan is where anatomy and aesthetics meet, because I want people to know the anatomy, not just can I come get Botox.
Yeah, no, I can definitely understand that. Now, a lot of your training came from overseas. How did that impact your career? I guess opening here.
Yeah. When I first was looking into where I was going to train, I was looking locally. However, you quickly find out that a lot of trainings are a day or two. They're not a lot of hands-on. It's hard to really there's no school for aesthetic medicine, right? It's hard to really get thorough training to where you feel comfortable enough to open your own practice. What I saw is that outside of the USA, there's a lot less restrictions, right? There's no FDA approval needed. They get a lot of products and technology way in advance. And they have, like this London Academy of Aesthetic Medicine is a much more thorough training. They provide those. Not to say there's none in the USA. I just found it more accessible outside. And they seem to have more of like a global perspective on aesthetic medicine. So instantly I was like, if I'm going to do this and I'm going to open my own spot, I need to make sure that I invest in the right training. And I think that's what drew me there.
Gotcha. Now, I heard a lot about, especially when we met at the conference, AmSpa, I heard a lot about global perspective. What does that kind of mean to you?
I think it means pretty much, I would say, in anything medicine related, and probably other fields too, I'm just not familiar, is that you can't just, how would I word this? To be the best provider, to be able to provide the best, most innovative care, I think you need to go outside of what's right next to you, like what your neighbor is. You need to go out of your comfort zone. And the more you learn from people who are not right next door, the better provider you can be, I think. And it also teaches you a little bit about, I know we had learned this in the AmSpa too, about diversity, right? We're mainly Hispanic here. So yes, I can say I can confidently treat a Hispanic, but truly, ethnicity, race, nationality, everything is different when it comes to the aging face and everything that happens below our skin. So learning that is easier when you leave from where, you're used to being.
Gotcha. Yeah, no, and that makes sense too, because there is so many diverse people that have different standards of beauty.
Yeah, and aesthetics should be for everyone. So you never want to limit your client or limit yourself. So learning those different versions of beauty, or like how the anatomy is different and how to treat accordingly, stems from not just learning from one place.
What did you think about the AmSpa conference?
I loved it. I think it was great. I loved meeting you. But also you network a lot, which I think is great in this field. You have to network. I also, you're so many top injectors are there teaching you their tips and tricks that you probably wouldn't get otherwise. So that was like a gold mine in itself. And I think my favorite part was the auction, or the one where you get to see the expo, where you get to try all the new technology and see what's up and coming. And that helps make decisions like buying these machines easier. And you get to test them there, some of them, which is nice, because usually you don't.
Yeah, no, for sure. Yeah, and it does give you a lot of knowledge. You're meeting, I was watching this video earlier, the provider was saying, if you don't network and have those small discussions with the group of people that you're around, you're kind of wasting your time at these conferences.
I agree. And we can learn from even our neighboring aesthetic injectors. I have like a group of a few other injectors that we're constantly bouncing off ideas from. So just imagine these national conferences where you're meeting so many and you learn a lot.
Yeah, for sure. What are people asking for right now in the Doral area?
I think Morpheus is honestly a hot topic anywhere at the moment, which I love because I have the machine. So, I hope it stays on there because it is a great machine. But I think Dysport, Botox, those will always be hot. What I'm trying to push more out now that I think is not as common in aesthetic medicine or underutilized are like biostimulators. So anything that like promotes your own collagen, elastin, like plasma, Sculptra, Morpheus is considered a biostimulator, hyperdiluted radius, all the things that like we're moving more towards naturally stimulating volume versus just using filler always.
Gotcha. How do you see the aesthetic industry kind of changing in the next couple of years?
I think that's definitely one. I think people are slowly but surely, even though they're not immediate results like a lot of patients like, if they trust the process, I think we're moving towards that route, which is a more natural route and a more natural looking route. And then we can still use the products we know and love, like filler, as additives or as like little accents to, the base of our face. So I think it's definitely moving in that route. And I think, we're constantly, every 5 years, a technique changes. So I think, it's a rapidly changing field. I don't know where it's going, but I know it's going in a better direction. It's going up. That's what I know.
There you go. For sure. How big is social media? Is it needed, or tell us a little bit about that?
It's too big. I mean, I don't think I realized it when I first started this to the extent of how important it is. I think in any business you open, not just in this field, but I slowly learned that it is like very, very important. And it takes a lot of time. And, investing in someone to help you with that, I think is worth it. Because at first I was hesitant and I was trying to do it on my own, but it is hard to be a full-time injector, run a business, and run your social media. Running social media is a full-time job. Yeah. But it's important because it gives your clients a chance to kind of see your work, see you speak, trust you a little bit before booking an appointment or coming in here. So I think if there's one advice I can give is it's take it almost as important as your trainings. Sadly, but true. It is our way of getting clients, probably one of the top ways of getting clients.
Do you have to like share your personal life?
I don't think so. I've been told that people enjoy that. I don't really do much of that just because I try to keep it work related. I do think people like to see like more of your personal side, and I can do better at that. But I don't at the moment.
Okay, for sure. Now, for injectors transitioning from the hospital setting to aesthetic medicine,
yes,
what are some tips that you can give them?
Okay, I think definitely try to find something I would have liked starting was finding a mentor. Find someone, and I try to do that as much as I can to anyone who asks. Try to find someone, they don't need to be super experienced or anything of that sort, but just someone who can guide you in the steps that it takes to get here. Because like I said, there's no school for this. You can Google it all you want, but it's not black and white like other careers. There's still a very big gray area. It still has a long way to go in the sense of how to get here. So I think finding a mentor, finding good fundamental trainings, and a cadaver course, I think is key.
Okay, for sure. How do you find a mentor? I know a lot of people say that, but they don't, people really don't even know what the first step is.
That's true. And I didn't either. What I would say is go on Instagram, again, social media, try to find a spa that's local. It doesn't need to be a big spa because usually those injectors tend to be busier and charge a lot of money for shadowing or even like mentoring, and just reach out through DMs. I did that a few times. I have people who do that now. And I think you'll find someone who's willing to just be like, hey, yes, sure, give me a call. Let me tell you and help you with what you can do next, etc. I think that's one way. You can call a few spas. Other than that, there's really no other way that I can think of.
Now, I know we spoke about AmSpa before, but what are some other conferences that you know of that might be great for the audience to attend?
Conference-wise, that was actually my first conference. I know there is some that come, at least if you're local in Miami, there's like the Miami Expo that they do. It just passed this year. Pretty much you can Google any like local medical spa conferences, aesthetic conferences, and the more the merrier.
Nice. What trainings would you suggest?
Okay, trainings I can help with. Definitely a cadaver course, any local, statewide, whatever the case may be. You can learn anatomy all you want in a textbook, but it's very different when you see it, feel it. And then you're just going to feel way more comfortable when you're injecting, which as a new injector, you're going to need that confidence. And then really any training course, with the injector bunny. Her name is Dr. Erica Berry. I'm sure a lot of people know her. Yeah. She's great. She's going to teach you every advanced technique you can think of. And if you book a Botox course with her, you're going to learn about sculpture, you're going to learn about filler, you're going to leave with way more than what you bought and a lot of hands-on training. Plus, she's a resource for life. And her Patreon page is a gold mine. It's really good. Anything on Patreon.
Nice.
Sign up.
Nice. Any key opinion leaders that you would suggest for people to follow and learn more?
Leaders, her, Injector Bunny. Oh, and then Dr. Rajani. He has a great YouTube channel. Anything related to complications, how to avoid it, how to treat them, he's your guy.
Awesome. And I'm just going to throw out Dr. Tim Ferriss too.
Dr. Tim Ferriss is good. If you get his book, it's amazing. There's so many. Yeah. We're lucky to live in an era where it's so accessible because I don't think it was like that back in the day.
For sure.
Plus, everyone's openly talking about the procedures they get. So that in itself is marketing.
I agree 100%. Well, thank you, Samantha, so much for sitting down with me, speaking more about the aesthetic industry. Tell everybody where they can find you and what you got planned next.
Okay, so you can find me. My clinic is called facebysp. Do I say my Instagram?
Yeah.
Okay, my Instagram is face_bysp. We recently expanded to something called Sprysociety. It's a little wellness center. I have a chiropractor, acupuncture, masseuse, facialist. So kind of a one-stop shop. That's my next step. And hopefully in the future, a training academy.
There you go. And until
thinking ahead.
I love it. Always for the future. Always keep going. And until next time, bye.
Bye.